By January 2017, the multi-million-dollar University of Ghana Medical Center would be opened to the public. Being the first super-referral facility in the country, the hospital is designed to provide cutting-edge medical training and specialist services, which over the years Ghanaians have had to look for in advanced countries. Vice President Kwesi Amissah-Arthur, who inspected the new medical center, expressed optimism that it would complement the Korle-Bu Teaching Hospital in bringing quality health care to the people.
The University of Ghana Teaching Hospital has been on the drawing table for decades, but the political will and decision was taken by the late President John Evans Atta Mills, who contracted an Israeli credit entity for the all-important hospital project construction, which began in 2013. The $217 million project is divided into two phases. The first phase is a 650-bed project, while the second phase will provide a 400-bed facility, making the University of Ghana Hospital a 1,000-bed facility. 96% of work is done on the first phase. Vice President Kwesi Amissah-Arthur, who was at the site to assess the project, was met on arrival by the Vice Chancellor, Professor Ebenezer Odro-Wusu, and the Interim Chief Executive of the hospital, Professor Aaron Lawson. The Vice President was conducted around the Emporium. The project comprises 8 buildings, each of which will be offering specialized services such as surgery, radiology, internal medicine, pharmacy, obstetrics and gynecology, pediatrics, as well as medical training in areas including robotic simulation. Other services include accident and emergency care with several support facilities. Mr. Amissah-Arthur was enthused about the immunocytochemistry facility used in pathological investigation. Over the years, Ghanaians have been seeking services provided by the immunocytochemistry facility in South Africa and India. The interim CEO of the hospital said the hospital would be serviced by a number of 3D high-tech equipment which will transmit results electronically.
In the long term, we hope to add other facilities like rehabilitation, psychiatry, and so on, and a medical hotel for relations of patients who are being attended to. We are not looking only at Ghana, but at the sub-region and beyond.
He said the teaching hospital would complement the services of Korle-Bu Teaching Hospital and not compete with it.
There are certain services which Korle-Bu does not have. You know, for example, if there's in the imaging unit, we're going to have under phase 2 an interventional radiology unit where someone gets a heart attack from a blockage of a coronary vessel. Instead of opening up the chest, 7-hour surgery, and then doing a bypass, you just go through a vessel here, guided, and it gets into the coronary vessel. You blow what is the clot and then put in a stent. Within 45 minutes, the patient is out of the theater. You know, so we're going to complement Korle-Bu rather than compete with them.
Vice President Kwesi Amissah-Arthur, who thanked those working on the project, said the old University of Ghana Hospital will not be closed down. It would rather serve as a primary facility, with the teaching hospital becoming a super-referral point.
It's going to be state-of-the-art. It has the best people. So they will all